everyone, and thank you so much for joining us on this very special show, Decoding COPD, the Silent Killer, which is brought to you today by the Times of India in association with CIPLA. I'm your host, Paromita Chatterjee. Now, today is World COPD Day, and we are here to talk about a respiratory disease, which many of you may not have heard of, but it is estimated to be the second largest cause of death in our country after heart attacks and heart disease. In fact, India today, it's estimated, could have more than 5.5 crore patients suffering from COPD. Now, the full form of COPD is a chronic obstructive pulmonary disease. Now, it is a respiratory disease, which is similar to asthma, but is also very, very different. And asthma is something that you and I have all heard about, but did you know that COPD is almost as prevalent, if not more, than asthma? And we'll find out more from our special guest today. Now, what's important with COPD is, given the fact that it is spreading in ever larger numbers in our country, in fact, more and more patients are being added to that list, and almost 2,000 patients are losing their lives every day to COPD. But the good news is that if you seek treatment early and at the right time, when the disease symptoms come in, then it can really alter the quality of your life and the disease can be managed. But with any chronic disease, it's really important for you to seek treatment at the right time. And today, there are many such treatment options which are available. And in fact, those treatment options are available and they've been brought forth by pharmaceutical giant CIPLA along with other players. CIPLA, though, has been amongst the prominent players in the respiratory diseases space and has done a lot of research and has been bringing in the latest treatment when it comes to treatments for lung diseases, including COPD. So it's appropriate that on World COPD Day, where we all want to learn more about this disease, which is growing in ever larger numbers in our country, that we speak with the Chief Medical Officer, and we are privileged to have with us today the Chief Medical Officer of CIPLA, Dr. Jaideep A. Gogtay. He is in fact the Global Chief Medical Officer at the pharmaceutical major. He has been working on respiratory diseases for a large part of his professional life and has been associated with CIPLA for more than 25 years now. So let's bring him on board. And there he is with us on the show. Dr. Gogtay, many thanks for joining us today on World COPD Day. And I must admit, COPD, it's something perhaps most of us have not heard about or are aware about, but looking at the numbers which are there, it's clearly something that we as Indians all need to wake up to. So explain to us, what exactly is COPD and how is it different from other respiratory diseases, including asthma?
So first of all, thank you, Paromita, for having me here. Indeed, chronic obstructive pulmonary disease, or more simply, if you want to call it just a chronic lung disease, is a condition in which the airways of the lungs and the lung tissue is actually damaged due to exposure of toxins outside the body. And the main toxin that we are exposed to is in the form of cigarette smoke. It's estimated that India has more than 100 million smokers, either cigarette or BDs, and many of them are at high risk of getting this particular condition. So in this condition, the airways get inflamed or swollen, eventually get constricted, the lung tissue gets damaged, and this makes it difficult for the air to move in and out of the lungs, thereby leading to symptoms such as breathlessness, repeated cough, repeated infections, fatigue, tiredness, and on many occasions, a diagnosis is not made till somebody lands up in the hospital with a COPD attack or a lung attack, as we have called it.
Mm-hmm. Right. You've explained those symptoms to us, breathlessness, production of mucus with a cough. I mean, it all sounds very similar to a disease that all of us have heard of, and that is asthma. How is it different in its nature from, say, asthma? And do the two actually have a close linkage?
Right. So asthma has been much more well known, but just to point out that asthma affects an estimated 3 crore people in India, while COPD probably affects around 5.5 crores, so almost twice the number of asthmatics, but it's unfortunately less well known. Now, both the diseases may have similar symptoms like shortness of breath or cough, but they're actually very different. Asthma more often begins in childhood or at a younger age, and in a large proportion of people, it's probably related to allergy. On the other hand, COPD more often occurs as age advances, and most patients who have COPD will have a diagnosis after the age of 40. Asthma comes on with a sudden attack. You have like intermittent symptoms of bronchospasm and wheezing and all. COPD comes on much more insidious. Shortness of breath slowly increases, repeated attacks of cough occur, infection occurs. As I also said that in asthma, because it is due to allergic origin and because it is often in children, in fact, the treatments can control asthma very well. You can almost lead a symptom-free life if you take your treatment as prescribed by the doctor and regularly. COPD, that's not necessarily a condition because you actually have damage to the lungs because of smoking or other factors as which may discussed. And many patients of COPD will continue to have symptoms almost always for the rest of their life. And therefore, it is so important to identify, diagnose, and manage COPD early.
Right, because this is the disease that is not going to go away, but at the same time, as you said, it is preventable. And we'll talk about some of those factors that lead to COPD. But first, tell us, we're talking about huge numbers here in India. I mean, globally as well, it is present in large numbers. But in India per se, 5.5 crore people, I mean, how many are actually diagnosed and how prevalent, how serious a problem is this?
Yeah. So I think we have a very unique aspect about COPD in India, which is very different from the Western countries. Almost 70 to 80% of the burden of COPD in Western countries is due to smoking. But in India, it's less than 50%. We have a very, very strong second component, which is important, perhaps even more important than smoking sometimes. And that's related to air pollution. And this air pollution may occur in rural areas indoors, in which very often we have cooking that is done by women in the house, using firewood, using twigs, using manure, and this gives off a lot of toxins which can damage to the lungs. And if the huts in the village are poorly ventilated, then women there can be exposed to these fumes for several hours a day. And this can actually lead to COPD in the long term. Interestingly, and actually very scary to know is, there are children often in the hut at the same time as the women, and they are exposed to this smoke from the cooking fuel right from a very young age. So that's a very, very big component of indoor air pollution, which is leading to COPD. Yes, I do know that the numbers of women using this firewood for smoking has come down with more access to LPG, but it still remains a very significant problem. And we hope that as time goes, this will decrease.
Okay, so that's a big factor in rural areas, which is
that's
your
a big factor
fuels that they use.
Absolutely.
What about urban areas? I mean, today all headlines are about outdoor pollution, smog in all the major cities.
Absolutely. So I think that's the third big component that we have to worry about is actually the prevalence of significant air pollution. Whether it is in the northern part of India that we see commonly in winter, or even in other parts of India today. You may have seen some of the data that in the top 10 polluted cities in the world, 6 to 7 come from India. That's not something to be proud of. But this is a thing that has to be dealt with. And air pollution will actually not just cause COPD, do exactly the same as what smoking does, but in people who have existing lung diseases, it can actually even worsen their condition and cause attacks. So these are the three areas really for us to seriously consider. 120 million smokers, a huge rural population still exposed to indoor air pollution because of the way they cook and what fuel they use for cooking. And third is the ambient air pollution that we now see in urban areas, which we have been talking for many years.
Okay, and it looks like all of us at some time, in fact, right now as we speak, are being exposed to some of these factors which can lead to COPD, given the prevalence of pollution, of course, the number of smokers as well. But But having said that, doctor, you said this is a disease that comes in later as opposed to asthma, which can happen in childhood. So 35, 40. I mean, we have viewers today joining us in that age group, what are those early symptoms that manifest?
So particularly if you have been exposed to any of these toxins, like you have been a smoker or you're still smoking or have been exposed to years of air pollution, indoor or outdoor, if you experience symptoms such as shortness of breath, now these come on very insidiously. So for example, most people are able to comfortably climb 2 floors or two floors without really getting any short of breath. But if you find yourself getting short of breath even at by the second floor, or you're getting repeated cough, you have a lot of mucus production or sputum coming out, you feel tired, it's important, therefore, to consider this is not a part of the aging process. Many people feel, I'm getting older, so I'm going to be a little more tired than what I was at 25. Not necessarily. In fact, if you have these symptoms, it may be important for you to visit your physician, not just get an ECG done to look out for heart disease or a blood sugar done to look for diabetes, but probably get a lung checkup done to check if you have any limitation of the air that moves in and out of your lungs.
Okay, so something known as, what test would that be? I mean, we all get some sort of, health checkup done. What would that test exactly be?
Right. So just like we have an ECG or an echo or something like that for heart disease, we have something called as spirometry for the diagnosis of lung diseases, especially COPD. So what a spirometer does is you have to breathe out into a small device, and that measures the amount of air that you're able to breathe out and breathe in. And if that is reduced as compared to what it should be for you, depending on your age and gender, then there is something what we call as this is airflow obstruction. And this is an important diagnostic test for diagnosis actually of COPD. So it has been strongly suggested by many global guidelines that if you have any of these symptoms and you have a history of either smoking or exposure to air pollution, then it is important to go and get a spirometric test done to look for early diagnosis of COPD.
And I think that's a message that all our viewers, including myself, will take home, that spirometry is something, a test, lung function test, spirometry, lung function test really is critical, I think, for all of us, because we are all being exposed to these trigger factors, which is pollution.
In fact, a lot of people remain undiagnosed because they don't undergo spirometer. Very often, people who have these symptoms will go to a doctor, get maybe a course of antibiotics, some cough syrups, and then go back. And they get a second attack after 6 months, or just a little worsening of the symptoms. So if we don't do a spirometer, we are going to miss a diagnosis. And it is estimated that almost 80% of patients probably have not been diagnosed within those 5.5 crore numbers that we've talked about.
Indeed, because to be honest, I don't see many people going in for a spirometry test, which is actually critical, because especially post-COVID is something we are all aware of, breathlessness and how serious the consequences can be. Then this is something that needs to be done. Now, you mentioned that India, of course, has the risk factors, which is the number of smokers, the pollution levels indoor and outdoors. But is there something else which makes us as Indians more prone to COPD per se?
So more recently, a few other risk factors have been identified. So, for example, repeated respiratory infections in childhood have been identified as an important risk factor for COPD in later life. Second, poor nutrition. So when a child is not doesn't receive adequate nutrition, it's not just that his whole body is not fully developed, even his lungs are not fully developed. And there is some data that has been published a few years ago by Professor Salim Yusuf from Canada, who in fact did a lot of work on heart disease initially. But in one of his studies, he had done spirometry on a very large Indian population routinely. And he showed that the lung function in Indians is about 15 to 20% less than in the Western population. Just the mere fact that we have a somewhat lower lung function, and this is not just because of maybe we are shorter or we are less in body weight, nothing like that. It's adjusted for all that. Maybe puts us even more at risk of chronic lung disease as we grow older.
Okay. And is there any linkage at all to heart disease? Because, India is also being seen as there's an epidemic of heart failure and cardiovascular disease as well.
Right. So more than 30 or 40% of COPD patients will have some associated other condition. We use a term called comorbidity. And the commonest comorbidity is actually heart disease. This could be a simple ischemic heart disease, hypertension, could be congestive heart failure or heart failure as it is called in the medical language. Is very important. In fact, it's not known to many that a large number of COPD patients may die, not just because of their breathlessness and the oxygen deprivation they have, but may actually die of a heart attack. So there is some link that is believed between a chronic obstructive lung disease and a heart disease. And this may be an important factor also to consider. Just look at it. Our number one cause of death in India is heart disease. Our second commonest cause of death is COPD, right? So which is the lungs, which also has an indirect correlation with the heart. Because it's interesting to just think, we breathe in about 11,000 liters of air every day, right? And out of that, we have about 550 liters of pure oxygen, which is then going through the lungs, through the heart, and into the rest of the body. So there is a strong link between these two organs, which are actually very much next to each other. So if you see the structure, the heart is in the middle and is enveloped by actually lungs. So there has to be some link between the two organs and their problems.
So, doctor, would you also send out a message that, if there's so many of us who've also been diagnosed with heart disease in some form, then they should mandatorily also get a spirometry or a lung function test done as well?
Especially if they have a history of smoking and if they have a history of exposure to pollution. Now, I can understand if we have been living in a polluted city for many, many years, you may not necessarily look at smoking as a risk factor, because many people will tell you that exposure to pollution is as good as smoking 5, 10, 15 cigarettes a day. So I think it's an important message also that if you have got heart disease, it may be worth it to go and yourself check for lung disease as well.
And doctor, what about I think there isn't anybody left who hasn't contracted COVID. I mean, post-COVID, again, is there a strong linkage of the lungs getting impacted?
So post-COVID, people who have recovered does not really cause or lead to COPD. No, there is no data or evidence to support that. However, if you have COPD and you get COVID infection, then the outcomes could be worse than if you didn't have COPD. We all knew that if people had underlying chronic diseases, could it be heart, could it be lung, then the outcomes of a COVID infection can be actually worse.
Right. Okay. Because, you were explaining to us that in the later stages of the COPD disease, you actually get something known as a lung attack. So clearly there are linkages with other diseases. Right. So now let's go to the disease progression. So early symptoms are breathlessness, some cough with mucus production, fatigue. But as the disease progresses, you brought up this term lung attack. We've all heard about heart attack, but what does a lung attack look like in COPD? And that's what we all want to avoid, right?
Absolutely. I think the most important thing that people want to avoid today is hospitalization. Nobody wants to go to the hospital. So just like you can have a heart attack, you can get a sudden lung attack where over a period of 2 to 3 days, your symptoms which are already existing actually dramatically worsen. So your shortness of breath becomes so marked that you are unable to walk even a few steps. You may be even breathless sitting down in a place. Your cough increases, you have lots of mucus production, you may get fever. The most common cause of this worsening of the disease is actually an infection or sometimes even exposed to sudden high levels of air pollution. Now, this infection could be virus, could be bacteria, and you may often have to be rushed to the hospital where they will put you in the emergency room, sometimes even in the intensive care unit, depending on how severe your obstruction is. Your oxygen saturation, and I'm sure everybody knows how do you measure today oxygen saturation, all that drops dramatically. So you may need treatment with oxygen, with a lot of nebulized treatment with bronchodilators, antibiotics, anti-inflammatories. And this is not uncommon at all. In fact, it's believed that all COPD patients eventually will have a lung attack sometime or the other. And the worse the disease, the greater the risk of lung attacks.
Okay, because that brings me to the way COPD is being treated here in our country today. I mean, are we seeing a situation where most patients are coming in with lung attacks and then the diagnosis is made, and by then the lungs are already considerably damaged? I mean,
Right.
what should be our goal when we talk about treatment and the kind of treatment options we are following in India?
Right, absolutely. So maybe a quarter or even a third of patients, their first time diagnosis of COPD is actually in the hospital, not in the clinic when the patient comes with symptoms. This sudden worsening, just like a heart attack, very often you see a heart attack only in the hospital directly. You may suddenly be diagnosed with COPD only in the hospital. So therefore, the recognition of symptoms early on is extremely important. What I mentioned earlier, the cough, the shortness of breath. And if we can make a diagnosis early by instituting treatment early enough, we may be able to prevent these lung attacks from happening. So treatments are fairly now standardized for COPD. There are international guidelines available as to how COPD should be treated. Of course, the foundation of treatment is stopping smoking. It's difficult to prevent exposure to pollution, but things like avoiding your morning walks in winter, particularly when there's a haze. And nowadays, governments have started issuing advisories. All of us know that schools were closed for a few days in Delhi recently. So these kinds of advisories, I think, is good that governments are realizing how important the exposure to air pollution is. So that's very important, is to prevent exposure to these toxins or reduce it. The second, of course, is using treatments with inhalers. Bronchodilators are the most commonly used treatments for COPD because they help dilate or they expand the airways, allow more air to flow in and out, and therefore improve symptoms. In a large number of patients, but probably a third of them, we will also require anti-inflammatory drugs as well, which are inhaled corticosteroids. That, along with the bronchodilators, helps in reducing inflammation in the airways and actually may help prevent lung attacks.
Okay.
So there are other treatments also available. For example, a lot of your muscles get weak as you grow older, especially with COPD. And they may need some form of what we call pulmonary or lung rehabilitation. So if you go to the hospital, they may ask you to join a rehabilitation program, which is actually very good because it will teach you how to breathe better, the type of breathing that you should be doing. They will teach you about nutrition, what kind of exercise you should do, how to improve your muscle strength. So I think if we are able to add pulmonary rehabilitation to inhaler treatment, stopping smoking, with all this, I think the patient's quality of life can really significantly improve and they can be far more active than what they were.
Okay, that's wonderful to know that clearly there are these options available, because the question here comes in that when somebody is given a COPD diagnosis, I mean, is there really a cure available? I mean, what should he or she expect in terms of the course of the disease and their own quality of life?
So as with all chronic diseases, there is no cure. We do know that diabetes doesn't have a cure, blood pressure doesn't have a cure. You have to take medications to manage your problem. Very similarly, COPD is a chronic condition. You have to take treatments to manage your symptoms, improve your symptoms, do some change in your lifestyle to help live with this problem. One other thing that I must mention is the importance of vaccination. We now know that taking a flu shot or getting a pneumococcal vaccination, and of course, this is as per the discussion with your doctor, this can help reduce the number of lung attacks and infections that may occur. So what patients can look forward to is that their symptoms will improve, they can be more active, they can travel, but we should also be alert to the fact that there could be seasons in which they have to be a little more careful. Perhaps with the onset of winter season where lung attacks increases or the infections increase. If there is an outbreak of flu in the community, we should be a little more careful. So I think if patients understand all this and physicians explain all this to patients, they can live with this problem far better than perhaps what they're living now.
But I think the bottom line, as you said, it is a chronic disease. There's no cure, but you have to learn to manage through lifestyle and treatment at the appropriate time, and have a fairly good quality of life. I mean, as normal as is possible. Now, having said that, you mentioned physicians, doctor. Now, if somebody is suspecting that they have these kind of symptoms, or maybe they've been exposed to those trigger factors, including being a smoker, should they straight away go to a specialist like a pulmonologist, or should they go to their general physician? What should be the line of approach when it comes to COPD?
So I think it's often a choice that patients make. There are many people who may like to go to a specialist directly because they've heard from somebody that, if you have these problems, go to a chest doctor. So that's perfectly fine. But many will equally go to a primary care doctor or a general practitioner or an internal medicine doctor. And it's important that all doctors need to be aware of COPD as much as they are aware of heart disease and high blood pressure. So if any patient comes with these symptoms, people must keep in their mind a possible diagnosis of COPD, especially if they have a history of smoking, they have an exposure to a lot of pollution, and they have symptoms which are suggestive of COPD. And therefore, as I mentioned earlier, perhaps there may be a strong indication in these patients to offer a spirometry test to just look for their lung function. If there is no airflow obstruction, then we are fine. But if there is airflow obstruction, then you've picked it up early and you can institute treatment and advice to the patient very early.
Okay, so in that sense, we've been doing some, discussions earlier about heart failure, for instance, and the minute people hear the term heart failure, they think it's a death sentence.
Right.
Similarly with COPD, doctor, explain to us, is it a death sentence in that sense? Can one lead a reasonably normal life despite being diagnosed with the disease?
I think absolutely. You can lead a reasonably normal life. I wouldn't say absolutely normal. There always is some compromise when you have a chronic lung condition, but you can be more active. You can do almost what you were doing within the limits of, if something is making you breathless or making you worse, then you've got to curtail your lifestyle in some way or the other. So your physician will clearly advise you of what you can do, what you cannot do. But if you manage your condition well, with all what I have suggested, and it's not that complex. Stopping smoking, I know it's the hardest thing to do. But today you have, for example, things which can help you. If you've made up your mind, using, for example, nicotine chewing gum can help you.
I want to ask a question here about vaping, doctor, because a lot of people think that, vaping is a smoke-free, sort of outlet. Is that true? Does it not impact the lungs?
So not an easy question for me to answer, Paramita, but I can say that people thought that vaping has no problems at all, but more and more data are emerging now that vaping may also have an impact on your lungs. We do have publications coming out that even vaping can be harmful, where it may or may not be as harmful as smoking, but we really don't know the long-term effects of vaping. Vaping has really picked up only in the last few years. So, the whole idea that vaping is safer than smoking, but anything that you inhale in your lungs, remember, which is foreign, which is not normal, is not something that your lungs, so they may manage 1 or 2 episodes, but if it is repeated, it's not going to be easy for your lungs to manage this all the time. So I would strongly advise, as much as people not to smoke, that avoid vaping as well.
Okay, so that's one big, sort of way to prevent COPD. What are the other measures, especially in terms of lifestyle? Because, lifestyle issues are cropping up everywhere. In all of us.
So remaining physically active within your limits is extremely important. So whether it is simply taking a walk, doing basic stretching exercises at home, or improving, very importantly, muscle strength. So one of the features of COPD that perhaps is not known is that along with the comorbidity of heart, there are 2 other things that one has to be worried or concerned about. One is a lot of COPD patients have what is called as osteoporosis. That is, they lose strength in their bones. Their bones actually become a little more brittle than otherwise. And second is the muscle starts weakening. And this is not muscles just of the lungs or the respiratory system, but also of your hands and legs. So the fatigue that sets in is not necessarily only due to less air or oxygen going in, but also to the fact that your muscles become weak. And this is well known in COPD. So muscle strengthening, good nutrition, people may advise you to improve your protein intake. So I think that becomes a very important part of your rehabilitation. So with the diagnosis of COPD, the advice on stopping smoking, exposure to other toxins, using inhaled medications as bronchodilators or anti-inflammatories, and on top of that, a rehabilitation program, or just getting used to this physically active lifestyle within the limits of what your doctor tells you. I think all this can be very important. So I think a good lifestyle is extremely important for patients with COPD.
That's good, and another wake-up call for all of us to really relook at our lifestyle.
I'd like to add another point here. What another unknown part of COPD has been, because people are breathless, they get anxious, right? And when you get anxious, you become even more breathless, right? So sometimes it's a vicious cycle that sets in, and often, managing anxiety. Many of these people can get depressed because they're not able to carry out their normal activities. So one has to look for all this to have a holistic management of the patient of COPD. While we may be more focused on managing the lungs, which is of course the most critical part of managing COPD, it's important to keep aware that looking at the heart, the muscles, the bones, and managing simple things like anxiety. This is where, along with the patient, the spouse, the family becomes very important in managing COPD.
Right. So there is clearly a mental health aspect as well. As you said, anxiety brought on by the physical aspects of having lesser breath capacity. In fact, you spoke a lot about comorbidities, doctor. The other thing is, for instance, diabetes. I mean, we are seeing a huge explosion in the number of diabetics. If somebody already is suffering from diabetes or has some of the other comorbidities like hypertension, which is again growing in numbers, how important is it to manage one's comorbidities while one has COPD?
So interestingly, in a couple of published articles, they have talked about the term, the diabetic lung, where there can be an impact of diabetes. So we know diabetes affects most organs in the body, the heart, the brain, the kidney, but we are also learning if diabetes can affect the lungs. Many of these chronic diseases have a kind of a chronic inflammation in the body, and no organ in the body is spared. So we do have some data to suggest that the lung function in diabetics is lower than people who do not have diabetes. So there is probably some cross linkage between COPD and all these chronic diseases, whether it is heart disease, whether it is diabetes, whether it is, as we talked about, osteoporosis or the muscle weakness. And therefore, the approach to COPD patients, while it is focused on the lungs, but should equally be focused on managing comorbidities, and vice versa. If you have any of these other diseases, right, make sure, or at least make sure you get a checkup done to see if your lungs are fine, because these also indirectly or directly are affecting the lungs.
Okay, so doctor, then coming back to this whole issue of COPD in our country and the rate at which it is spreading, would you say that it's more important to focus on prevention, or is it more important to focus on getting the right treatment? Where are we at right now in terms of our COPD graph?
So we have to target always, as with any disease, at multiple levels. So if we talk about prevention, that requires a lot of effort, not just from an individual or a community, but also from legislation. So whether it is we now talk about smoke-free public places, or we talk about offices, most people are no longer allowed to smoke, right? I remember many years ago in offices, smoking was permitted, but in most offices, no longer. So I think those are good steps that we can reduce exposure to these toxins. So we only talk of smokers, but remember, secondhand smoke can be equally dangerous, because you may be sitting in a room full of people where others are smoking, but you're not. But then you are also smoking because of secondhand smoke. So
and that includes if your spouse is also a smoker.
Absolutely.
Right?
So your family members, secondhand smoking. There's in fact a very fascinating concept recently of what is called as third-hand smoke. That even after a smoker has left the room, right, and you're no longer in front of that person, there are remnants of the smoke lying in different parts of the room. So I don't know more about it, but that people have talked of even third-hand smoke nowadays. So legislation at an individual level, at a community level, is something that we can certainly do to prevent COPD. Managing air pollution, I think the governments have very much taken up, whether it is air pollution per se, whether it is climate change. I think governments have woken up to the fact that this is the environment has to be really managed. How and when we do it is, I think, an effort that all of us have to make. But we also have to deal with 55.5 crore people with COPD. How do we diagnose them early enough so we can institute the right treatment and preventive measures? How do we help them lead a quality of life which is as good as it can be? And it can be pretty good, especially if you bring them on early. Do we have access to all the inhaled medications across the country? While in many urban areas, many towns it is available, it may not be available across all of the country, but it's important that this becomes available. And a simple exercise program for patients. I think if we're able to bring all this, we can do a lot more for managing COPD than what perhaps we are today.
And doctor, in terms of treatment options today available in India, how do we compare with what is available, especially in the developed countries, in the US and so on? Are we there in terms of the latest treatments available for patients?
So absolutely, this is one area for both COPD and asthma, where you have all the treatments that are available in the West available in India. In fact, the options are more in India. The type of inhaler devices, the more what I would call patient-friendly inhaler devices, you have a variety of them in India, more than what you would have in developed countries. And importantly, at prices which are way below what you would get in Western countries. For example, I can mention to you that a particular inhaler in the United States would cost $300 a month. In India, you can get it for less than $7 or $8 a month. So the price differences are enormous, and I think there is availability of affordable medication in very much patient-friendly inhaler devices that are there. I think what we just need to be more aware of these inhaler devices, about the availability of this across parts of the world, and I don't see any difference in the quality of treatment that can be offered in India as compared to Western countries.
Okay, that's great to know that we have actually the latest and developed by companies such as yours, which has been at the forefront, and it's available at a much lower cost. So, Doctor, I think we've really understood why it's important for all of us today as Indians to wake up to the reality and threat of a disease like chronic obstructive pulmonary disease or COPD. It is something that all of us are likely to encounter, whether it is with our loved ones or perhaps ourselves, if we don't take those precautions and also take treatment at the right time. So, Doctor, what would be your message today? Somebody who has really spent more than 2 decades of your life really, researching and looking at all the treatment options. What would be your message today to our viewers?
So I think we always remember the person who stood first in the classroom. In mortality, it is heart disease. Don't forget the fellow who stood second. Here, this is COPD. So I think just the awareness that chronic obstructive lung disease is a huge problem in India, is the second commonest cause of mortality after heart disease. Just the awareness that there is something called chronic obstructive lung disease or COPD. That's important. Second is the awareness of symptoms. If you get the following symptoms, go to your doctor, ask for a lung health checkup. If the lung health checkup shows COPD, you will be treated for COPD by the doctor. And 3, important to know that there are treatments available for COPD as good as what is available in Western countries. Prevention of stopping smoking, reducing exposure to toxic air, and the fact that you can get into an exercise program is 3 or 4 things that you can really do to overall reduce the burden of chronic obstructive lung disease for our country.
And finally, Doctor, your message to those who are already suffering from COPD, and many of them perhaps have been diagnosed towards the later end of the disease. What would be your message to them?
So I think my message to them is nobody should lose hope if they've been diagnosed with COPD. With all the right treatments and the management strategies we now have in place, most COPD patients should expect to lead a pretty good quality of life, right? But they have to be careful. They have to watch out for certain things, like I mentioned about seasonal variation. They have to look at vaccination. We have to make sure that they take their treatments properly, get into an exercise program, and then do it at home. You don't have to keep visiting. All this can help reduce your risk of getting into the hospital and overall leading a much better quality of life.
Dr. Jaideep Gogtay, thank you so much for joining us. It's been such a learning experience. I think we've all learned something very new and very important for our own health and the health of all of us and our loved ones today, which is about COPD, the disease, which is the second largest cause of death here in our country. But the good news is it is preventable, provided we take care of some of those risk factors and, of course, take care of our lifestyle as well. Dr. Gogtay, thank you so much for joining us. And thank you to our viewers. Breathe well, live healthy, and remember, COPD is a disease which is there. It's impacting Indians, but treatment is there at hand. So don't hesitate and go out and ask your doctor today. Thank you.
Thank you very much.